Hello, NephU community. My name is Cibele Pinto, Senior Medical Science Liaison with Otsuka Pharmaceutical Development and Commercialization, Inc. I'm here with Lavonne Burrows, and she'll share with us her personal perspective on the field of nephrology nursing. Lavonne graduated from the University of Missouri School of Nursing in 1978 and later graduated from the University of Kansas with her master's in nursing. Lavonne has worked the majority of her career in nephrology, both inpatient and outpatient, hemodialysis and peritoneal dialysis, and has had staff and management positions. Currently, Lavonne works as an advanced practice registered nurse at Branson Nephrology in Branson, Missouri. She has functioned as an APRN for about 20 years. Lavonne is active in professional organizations including American Nephrology Nurse Association, Nephrology Nursing Certification Commission, and Advanced Practice Nurses of the Ozarks. She has been an author and co-author on 8 peer-reviewed journal articles and 3 book chapters. Thank you for joining us today. Why did you decide to go into nephrology, and what does it mean to you to be a nephrology nursing?
I didn't really decide to go into nephrology so much as I just got interested in it. So when I graduated from nursing school, I worked at a VA hospital in surgery, and I ended up working in the intensive care unit, and they did hemodialysis in the intensive care unit, so I thought it was really interesting, all the technology, and eventually moved into hemodialysis and ended up staying in nephrology pretty much my entire career after that. I did go into different parts of nephrology. I've worked in home dialysis, peritoneal, and a little bit of home hemo, and then I did some management for a while. I did go back and get my master's, and now I do advanced practice nephrology as a clinical nurse specialist. So office and dialysis rounds and hospital settings, so I've kind of done a little bit of all of it.
What is the biggest challenge being a nephrology nurse and also a reward within your profession?
You know, I think the biggest challenge is helping patients understand complex medical issues and lifestyle changes that are needed with kidney failure without overwhelming them and without becoming too judgmental. I think of all the restrictions that they have, all the medicines they have to take, all the dietary issues, and I put myself in that place, and I'm not sure I would be a very compliant, adherent, whatever that word is that's in vogue now. I'm not sure how well I would do personally. So it is challenging, but it's also very rewarding when you see people embrace that and actually feel better. And one of the really rewarding things that has happened lately with the ability to do acute kidney injury patients in the outpatient dialysis setting, when you see the renal recovery and they're able to come off dialysis, they're so relieved, as I would be too.
How have you seen the nephrology field evolve in the many years that you've been a nephrology nurse?
So I think the biggest change over the years has been the technology. We've come a long way. The machines are much more foolproof than they were initially. I worked with an administrator years ago that said they could make a dialysis machine that's foolproof if fools weren't so ingenious, but they are almost foolproof now. So it does make it a lot easier. And for home therapies, they're so much simpler than the type of treatment requirements that when I first started.
Do you have any advice for nursing students who are thinking about specializing in the nephrology field?
From my experience, I've seen people that have started on it. It seems to me that when you get into nephrology, you love it or you hate it. So if they're going to try it, it's probably something that will be a good fit, or if it isn't, they probably need to just think about a different option. But it can be very rewarding. It's challenging to deal with a chronic patient population because you see the same patients over and over again, and for some things that's good, and for some things it's not so good.
What part do you see nephrology nurses playing in advancing kidney health care?
You know, I think being good clinical observers to look for trends. I know when I round in the dialysis unit now, I rely very heavily on input from the nurses that see these patients in the hemodialysis clinic on a day-to-day basis, because they have a lot more insight than I do when I'm seeing them just occasionally. And the home dialysis nurses are amazing because they can figure out a lot of things. I always tell the nurses that I work with that it's a blessing and a curse to have such great nurses, because the blessing is they've already figured out most of what's going on. The curse is by the time they call me, then it's a really hard problem, so it's hard for me to figure out what to do next.
If you are a member of ANNA, what does it mean to you, and what benefit do you gain by being a member of ANNA?
So being a member of ANNA has been beneficial in terms of networking, meeting people, just having resources. We dialyzed a patient years ago who was 18 years old, but she was a spina bifida patient, and she was very, very small, so she only weighed about 20 kilos. And we had a terrible time when we tried to dialyze her. And then it occurred to me to contact someone that I knew through ANNA who took care of pediatric patients, and she gave me some tips on things to do, and the patient did much better. So just having those resources when you have something come up that you've never seen before, so that you take better care of the patient.
Do you have any educational professional achievements that you want to highlight?
I've been very fortunate to have wonderful mentors. Barb Prowant, many of you may remember her. She was my window into nephrology when I first started in hemodialysis, and she was a wonderful mentor. She actually submitted me for a management award that I was awarded in 1996 through ANNA, so that was great. I've also been pretty active in ANNA. I was on the CEAB commission, which is no longer active, but we approved educational activities for contact hours. I'm involved in NNCC, the Nephrology Nursing Certification Commission, as a chair of the CDN exam board. So I've done a lot of things in nephrology. I've been involved in the network at various times. I've written some book chapters, and probably one of the things I'm most proud of is three of us, me and two other nurse practitioners, wrote an article for the Nephrology Nursing Journal that won the Clinical Writing Award in 2015, so that was very special.
What do you like to do outside of nursing? What are your hobbies?
Oh, I love to travel, see new things, eat new foods. I love to read. Just hiking is great. I'm pretty into sports, so watching in person, or there's always sports on TV at home. And one of the things I've started doing now is trying to learn a new language, so I'm practicing my Spanish so I can go to Spain.
Can you tell us about a memorable patient experience?
There was a lady who was in her 70s. She was a polycystic kidney disease patient, and we were seeing her in clinic. She was not on dialysis yet, but she was getting close to needing dialysis. And I remember talking to her about being evaluated for kidney transplant. She kept telling me, oh, I'm too old. But she was very active. She was still working full time, and she finally decided she'd go ahead and go through the process. She ended up getting transplanted. I think she ended up having 2 hemodialysis treatments before she got her transplant. And I saw her for several years after that at the clinic, and she was always wonderful and very appreciative that I hadn't just pigeonholed her, and just because she was 70 years old said you're not eligible for these things. And she did wonderfully well, and just to see her blossom and thrive and do so well after transplant was very memorable.
I want to thank Lavonne for joining us today and shining a light into the nephrology nursing field. Thanks for tuning in, and we hope you enjoyed the discussion. We'll see you next time here on NephU.